Well, my name is Dr. Tanya Di Genova. I am a pediatric intensivist here at the Montreal Children's Hospital, and I'm also Associate Director of Professional Services here. And where we are is at the Montreal Children's Hospital in the ambulatory sector. L'Hôpital de Montréal pour enfants est un centre universitaire qui est tertiaire. Et qu'est-ce que ça veut dire? Ça veut dire qu'on offre des soins ultra spécialisés pour des maladies rares, pour des maladies chroniques, complexes, durant la phase aiguë et chronique. On offre des services ou du traitement ultra spécialisés comme la greffe, des chirurgies de cœur complexes et plusieurs d'autres. La différence entre les hôpitaux communautaires et l'hôpital de Montréal pour enfants, c'est le niveau de soins qu'on donne. Alors, quand un hôpital communautaire prend soin d'un patient, quand ça rentre à un certain niveau, les patients ont besoin d'autres expertises, alors les patients sont transférés à notre hôpital pour avoir les expertises d'une centre tertiaire. Et ça veut dire des soins aigus, des soins intensifs pédiatriques et néonatales, certaines chirurgies spécialisées et beaucoup d'autres. L'avantage d'avoir deux centres spécialisés en pédiatrie à Montréal, c'est vraiment d'avoir l'accès aux soins spécialisés en pédiatrie pour notre enfant québécois. L'autre avantage, c'est vraiment d'avoir ou avoir la complémentarité, la collaboration entre les spécialistes pour la recherche, pour l'innovation clinique et beaucoup d'autres. The Montreal Children's has really led clinical innovations for decades. The fields that we're specialized in are really fields that have to do with ultra-specialized care, such as rare diseases, complex care diseases, both in their acute phase and chronic phases. We are highly specialized in a variety of other specialties like the kidney and the brain and many others. So we do take care of the sickest children in Quebec. Innovation is always at the forefront of the care that we deliver. We do that through research. We do that through clinical innovation as well. If I can name a few examples, in the Department of Surgery, we have our general surgery division who have created multidisciplinary clinics to address certain congenital anomalies like congenital diaphragmatic hernia, like colorectal. And what these do is really a one-stop shop for families who come with these complex diseases. What a one-stop shop in general surgery clinics means is having that multidisciplinary team, so the physician, but also the allied healthcare, the nursing there to meet the family and address their concerns all together, so the family does not have to necessarily go to different clinics to see every expertise. If I can name other examples, we have Dr. Sam Daniel, who has been at the forefront of offering Botox for children, newborns with vocal cord paralysis. This saves them from having tracheostomies, and it's been a life changer for many, many patients. We have specialized teams with expertise that care for these patients with rare diseases. And what does that really mean? These teams are specialized both in research and clinical innovation related to rare diseases. That means trying to make sure that their care is coordinated, trying to make sure that we get the right diagnosis for these patients, and also trying to find the right treatment choices for these patients, which is sometimes difficult. And sometimes when we don't have the local expertise, our teams leverage other expert teams in North America, around the world, to make sure that our patients get the care that they need. We value and prioritize collaboration. We cannot do this alone, especially when it comes to rare diseases, where it's not always obvious what the disease is and what the treatment plan is. So we foster these collaborations. We network. When we meet new people at congresses or conferences, we make sure that we create this network so our patients get the best care. We have healthcare workers that publish hundreds of articles in journals from around the world, high-end journals from all around the world. We also have healthcare workers present at congresses and conferences. We also have won, a very long list of awards, even just in this last year. We have 3 new members in the Order of Canada just in this past year, Dr. Panaro, Dr. Jabedo, and Dr. Shemi, to recognize their great work that they have done. So our ICANN program is a program that we have put together in the last 5 years to help intermediate care needs, patients with complex care needs, and to help them coordinate their care. This program has been recognized nationally and internationally and has also won le Prix d'Excellence du Ministère de la Santé. We have healthcare workers here that have led many initiatives. For example, we have Dr. Sam Shemi, who has led international guideline development on end-of-life and organ donation. We have Dr. Nara Jabedo, whose work in pediatric brain tumors has really changed the way brain tumors are diagnosed and treated. So we have a slew of other clinical innovation projects that we're doing here at the Montreal Children's Hospital. One that we're very proud of is our simulation center, led by Dr. Lana Bank and Kelly Cummings. They do a fabulous job of training. They have trained over hundreds of healthcare workers by in situ simulations. So what does that mean? They mock and they create scenarios, clinical scenarios, so trainees can learn. That's nursing, allied healthcare, physicians, trainees. We've been clinically innovating here at the Montreal Children's forever. Over 50 years ago, Dr. Scriver had founded vitamin T deficiency as the cause of rickets, and he partnered with Steinberg grocery stores to ensure that our milk here in Quebec had vitamin D. And that was all because of a physician here at the Montreal Children's Hospital. Here at the Montreal Children's, we really prioritize patient and family-centered care. What does that mean? We include the family right from the get-go. So even on bedside rounds, for example, in the mornings when we are discussing a patient with the allied healthcare team, with the nursing team, we include the family in the discussion. We ensure that they understand what we're saying, we get their perspective, and that they understand the plan. What we want to ensure here at the Montreal Children's is that you get the care you need, but that you're also followed up adequately. One of the projects that we have recently led is a project that ensures that every patient that leaves the Montreal Children's Hospital when they're born has follow-up. So that means either with a pediatrician or a family doctor. As a pediatric intensivist, so first of all, I love both jobs that I do. So I'd mentioned I'm a pediatric intensive care physician, and I'm also the Associate Director of Professional Medical Services here at the Children's. And I feel like these two roles really complement each other very well. As a pediatric intensivist, I meet families in their most vulnerable and stressed state. I meet them in a place where they're suffering, and I feel like I do provide or make a difference in their lives. I love the physiology of intensive care. I love the medicine. I love the fast pace. And I can also say the same thing about the associate directorship. I love the people. I love the collaboration. I love helping the teams here at the Montreal Children's. I love bringing this place to the next level. I appreciate and I love strategizing and innovating with the teams here. I did want to mention our healthcare workers. So at the Montreal Children's Hospital, we deliver first-class care to our patients. We do that by making sure that we innovate, that we do great research, by providing great care. And the people that provide this great care are our fantastic healthcare workers. And without them, without the extra mile that they go for families, we wouldn't be who we are today.